We all strive to live a long, prosperous, and healthy life. With advances in health and medical sciences, this goal is ever more attainable. The Sam and Rose Stein Institute for Research on Aging is a non-profit organized research unit under the auspices of the University of California at San Diego, committed to advancing lifelong health and independence through research, education, and patient care. To better empower and improve the lives of young and old alike, the Stein Institute presents the following program.
Good evening. My name is Dilip Cheste. I am the director of the Stein Institute for Research on Aging. The Stein Institute was established in 1983, and its goal is to promote research training, and community education in aging in general and successful aging in particular. It's really my pleasure and a privilege to introduce today's speaker, Dr. Sonia Ankoli Israel. Dr. Israel is Professor of Psychiatry at the UCSD. She is also the Director of UCSD Sleep Medicine Center. She is a co-director of the Gillen Laboratory of Sleep and Chronobiology and Director of Psychiatric Sleep Disorders Clinic at the San Diego VA. Dr. Israel is a pioneering researcher in the field of sleep and chronobiology. She has published more than 300 papers and 3 books. One book particularly I want to mention is called All I Want is a Good Night's Sleep. Dr. Israel has been president of several major societies. These include the Sleep Research Society, the Society for Light Treatment and Biological Rhythms, and Association of Professional Sleep Societies. She is also the deputy editor of a journal, Sleep. Dr. Israel has worked on different aspects of sleep, but she has focused mainly on studying the longitudinal effects of sleep disorders on aging, the relationship between circadian rhythms and cancer, and use of light therapy in various sleep and chronobiology disorders. Today she will be talking about why grandma and grandpa can't sleep, changes in sleep with age. So please join me in giving a big hand to Dr. Ankoli Israel.
Thank you, Bill. Thank you so much for inviting me, Dilip, and for such a lovely introduction. I'm blushing. It's really my pleasure to be here this evening. There's a little risk in speaking about sleep in the evening, but let me tell you that if you fall asleep while I'm speaking, I know it means you have a sleep problem and has nothing to do with what will be a very entertaining talk. So, having said that, let's start. Here's a cartoon of Marvin and his grandpa. And they're playing a game, and Grandpa falls asleep, and Marvin thinks, Grandpa fell asleep playing with me. I better put these someplace for safekeeping, and he takes Grandpa's glasses. And of course, it's not the glasses that I care about here. It's the fact that Grandpa fell asleep while playing a game with his grandson. And people think that not only is this funny, they think this is normal behavior. And if you don't remember anything else from tonight's talk, remember this. Falling asleep while playing a game or while doing anything else when you should be awake is never normal behavior, no matter what the age of the individual. So the question becomes, why do we tend to fall asleep as we get older during the day, and what happens to our sleep? If we look at what older people versus younger people report about how much they sleep, we find that there's not much difference. These are data collected by the National Sleep Foundation, which is a nonprofit organization whose mission it is to educate the public about sleep. And each year they do a poll on sleep, and in 2003 the poll was in older adults. And they compared the data of the older adults to previously collected data in younger adults. So we're looking at here, the blue are adults aged 18 to 54. The purple is 55 to 64 years old. The yellow is 65 to 84. And this orange is the combination of these two age groups. So it's 55 to 84. And this is how many hours a night people reported sleeping during the week. And what you see is that the younger adults report sleeping 6.7 hours, so close to 7 hours. The older adults also report sleeping 7 hours. So this myth out there that older adults report sleeping less than younger adults may in fact be just that, a myth, may not be true. Look what happens though on the weekends. On the weekends, the younger adults are sleeping over 7.5 hours, and the older adults are still sleeping 7. And what's happening is these younger adults during the week are sleep depriving themselves. They're staying up late watching TV or surfing the internet. They're getting up early to go to work, and they're not getting enough sleep. So what happens on the weekend is they're sleeping in to try to make up for all the sleep that they lost. Older adults don't do that. They get closer to the right amount of sleep both on the weeknights and the weekends. So in general, older adults do report sleeping about 7 hours of sleep a night. Now, it is also true that our sleep does change some as we get older. Sleep is divided into different stages of sleep. We call them very simply stage 1, 2, 3, and 4, where stage 1 is the very lightest level of sleep, and stage 4 is our very deepest level of sleep. Stage 3 and 4, those two deeper levels, are also called slow-wave sleep because that describes the frequency of the brain waves. But what's important here is that our slow-wave sleep, we have age across the bottom here, and our slow-wave sleep actually decreases with age. But you see, it's not just in our older years. It actually starts decreasing in our 20s and 30s. So I'd venture to say for almost all of us in this room, we've already started losing our deep sleep. And certainly by the time we reach our 50s and 60s and 70s and above, we have very little deep sleep. What that means is that most of the night is spent in lighter levels of sleep, which means you're more likely to be disturbed by noise or other things going on in the environment. The other thing that also changes as we get older is our sleep efficiency. Sleep efficiency is defined as the amount of sleep given the amount of time you spend in bed. So in an ideal world, that would be 100%, right? You'd be asleep the entire time you were in bed. But of course, it takes everyone at least a few minutes to fall asleep. Everybody wakes up once or twice during the night. So we consider a sleep efficiency of 90% or above to be good sleep efficiency. And you see here that with age, in both men and women, sleep efficiency does drop. So that means that as we get older, we're sleeping less given the amount of time that we're in bed. It's also true that the complaint of insomnia increases with age. In the younger population, about 10 to 20% of adults complain of insomnia. In older populations, it's closer to 20 to 50%. So why is this happening? Before we get to why do we care that this happens? Why do we care that older adults might be getting worse sleep or sleeping less? Well, we care because there are consequences to not sleeping enough at night. Those would include problems with attention or concentration. It would mean a slower response time. And you know, we often measure response time by how quickly someone can push a button in response to a tone or a light, but that's not what we care about. Think of response time as the amount of time it might take you to slam on the brakes if a child runs in front of the car that you're driving. Okay? So response time is very important. And when you don't get enough sleep, that's slower. And then problems with performance. It's harder if you're not alert to do well in whatever you're doing. The problem with all these symptoms in the older adult is if an older adult goes in to see his or her physician and says, you know, I'm having problems with my memory, I'm not concentrating well, I'm sort of moving slower than I used to, that physician might think that those are symptoms of dementia. But in fact, they might really be symptoms of just not getting enough sleep at night. So why does sleep get worse as we get older? Is it because we're getting older? No, it's not. Age on its own doesn't cause sleep problems. Very healthy older adults have no problems with their sleep and sleep just as much at their older age as they did when they were younger. But it's all those other things that happen to us as we get older that do make it harder for us to get the sleep that we need. And I'll just read this cartoon to you. It says, the nurse is asking age, and he says, I sure do. So what are all those factors? What are all those things that happen to us that make it harder for us to get the sleep that we need? Well, medical and psychiatric illnesses, all the medications that we need to take because of these medical and psychiatric problems, changes in our circadian rhythms or our biological clocks, and a higher prevalence of some very primary sleep disorders. And what I'm going to do is touch at least a little bit on each of these. So let's start with medical conditions. Just about any medical condition that causes discomfort is also going to cause problems with sleep. So headaches, congestive heart failure, COPD, pulmonary disease, any of the neurodegenerative processes, Parkinson's disease, dementia, pain of any sort, whether it's from arthritis or cancer or anything else that might cause pain, GI problems, if you have reflux at night, that's going to disturb your sleep. So you see, just about anything that can go on in your body, and all of it does at some point, will affect our ability to sleep at night. It says you shake, rattle, and roll, twist and shout, and you're tossing and turning all night. It's either menopause or too much oldies radio. Well, for the women in the audience, menopause also, of course, is going to affect how well we sleep. And it's mostly the hot flashes that women experience during menopause that disturb sleep at night. But it's something else that happens to us as we age that then disrupts the sleep. And the more medical problems we have, the worse sleep gets. So these are data, again, from the National Sleep Foundation poll. This time the blue means the person had no medical or psychiatric problems. The purple is they had one medical or psychiatric problem. The yellow is 2 or 3. And the orange is 4 or more problems. These are people that reported sleeping less than 6 hours a night. These are people that reported having any insomnia at all. And these are people that reported being excessively sleepy during the day. EDS stands for excessive daytime sleepiness. And as you see here, the more medical or psychiatric conditions a person has, the worse their sleep gets at night. And unfortunately, as we age, we do get more and more medical things wrong with us. And so that's one of the reasons why the ability to sleep is decreased as we get older. Okay, here's Marvin again with his little cousin, and he says to his cousin, how come Grandpa never goes to a job like other big people? Because he works at home, silly. See, he runs a drugstore. Well, polypharmacy is also an issue as we get older. Because we have so many more medical and psychiatric problems, we have to take more and more medications. And many of those medications that we need to take also disrupt sleep. So this is just an example of some medications that are known to disrupt sleep. So stimulants of any sort, if they're taken in the evening, are going to make it harder to sleep because they're activating, they keep you awake. Antihypertensives, some of our respiratory medications. Chemotherapy is known to cause many sleep disruptions. Decongestion, some of the hormones, drugs we take for our psychiatric disorders. All these drugs are known to make it much more difficult for a person to sleep at night. It says, how much are sleeping pills? 10 cents. Why so cheap? The wake-up pills are 12 bucks. Well, just like they're drugs that keep us awake at night or that are activating, they're also drugs that are very sedating, like some of the longer-acting sedative hypnotic sleeping pills, many of the antihypertensives, antihistamines, tranquilizers, antidepressants. If you take a drug that makes you sleepy during the day and you actually fall asleep, that might then disturb your sleep at night. And sometimes by just adjusting the dose of your medications, by having your physician adjust the dose of your medications, or vary the time of day that you take these medications, you can have a tremendous positive impact on your sleep. So the activating, alerting drugs should be taken earlier in the day. The sedating drugs, the ones that make you tired, should be taken later in the day. And by doing that, as I say, you can often help your sleep. Okay, so we've now talked about the fact that medical problems decrease the ability to sleep at night, medical and psychiatric problems. We've talked about all the medications that we take that decrease the ability to sleep at night. Let's now move to circadian rhythm disorders, or changes in our biological clock. Our sleep-wake is very much controlled by our biological rhythms. And you know the famous Ben Jefferson quote, "Early to bed, early to rise makes a man healthy, wealthy, and wise." Well, that early to bed, early to rise actually defines what happens to sleep as we get older. And because of this, and I'll show you what happens in a minute, but this is why when we go to the opera or the symphony or to lectures at night, we sometimes have a hard time staying awake. They're at the marriage counselor, and the dove is saying, "It's no use, I'm a morning dove, he's a night owl." Well, there really are such things as owls and larks, or morning people and evening people, and that is determined by our circadian rhythms. So, if we look at these biological rhythms, what we find is that the standard rhythm for most adults is that we get sleepy around 10 or 11 o'clock at night. We go to bed at that hour. We'll sleep for about 8 hours, which means we're waking up at around 6 or 7 in the morning. Okay? Part of what determines when we get sleepy is our core body temperature. Core body temperature drops at night, right around here. That's when we get sleepy. And it rises in the morning hours. That's when we wake up. But at different times in our lives, this pattern shifts. So, how many of you have teenagers or grandchildren that are teenagers? Show of hands. Huh? How many of you used to be teenagers? Okay. You might remember not wanting to go to bed, or you might observe this in your kids, not wanting to go to bed till about 1, 2 in the morning, and then sleeping till noon the next day. And as parents, we always yell at our kids and say, "Stop being so lazy. Go to bed at a reasonable hour and get up at a reasonable hour," right? Well, it turns out that this is a very normal pattern for adolescents and teenagers. We call this a delayed sleep phase. What happens in our adolescent years is that this circadian rhythm shifts or delays so that their core body temperature isn't dropping till about 1, 2 in the morning. So if they go to bed at 10 or 11, they have a very hard time falling asleep. It might take them hours to fall asleep because their body just isn't ready for it. If they go to bed at 1 or 2, they have no trouble falling asleep. Okay? But if then you count out 8 hours, and in fact adolescents need closer to 10 hours of sleep, you find out that in fact they're waking up at 9, 10, 11, or noon. So this in fact is a very normal pattern in teenagers. Some adults actually stay delayed their whole life. We now know there's a genetic component to that. And you often see it in families, you know, a parent who doesn't like to go to bed till 1 in the morning, and then a child who doesn't like to go to bed till 1 in the morning either. Those are our owls, our night people. They're most active and most alert late in the evening, but if you try to get them up at 6 or 7 or 8 in the morning, they can barely open their eyes, because for them, that's still the middle of the night. Their core body temperature isn't rising till later in the morning hours, and they're not waking up till later in the morning hours. Now, most people, although some people stay delayed their whole lives, most people shift this rhythm as we get older, as we grow out of adolescence and our teenage years. It shifts back to this so-called standard pattern. But as we continue to get older, it continues to shift, so that older adults have what we call advanced sleep phase. Now, it doesn't mean you wake up on your 65th birthday and suddenly you're advanced. This is a gradual process that goes on as we get older. What's happening in the advanced sleep phase is that core body temperature is dropping early in the evening, around 6, 7, or 8 o'clock in the evening. And for many older adults, that's when we get sleepy. Right? If we went to bed at this hour, 6, 7, 8 o'clock, we would get a full night's sleep. But if you count out 8 hours from 6 or 7 in the evening, you realize that's 3, 4, 5 in the morning. What's the biggest complaint an older patient will have about their sleep? I'm waking up in the middle of the night. Here it is, the middle of the night, and I can't get back to sleep. Well, yeah, they can't get back to sleep because their core body temperature is rising here. Physiologically, their night is finished. The problem is the sun hasn't risen yet. It's still dark out. But in terms of their own body, their night's sleep is done. Now, here's the problem. If they really went to bed at 6 or 7 in the evening, there would be no problem. They would be getting a full night's sleep. But how many of you really go to bed at 6 in the evening? Probably nobody. You stay up because you want to socialize with your friends, you want to read. It's not socially acceptable to go to bed early. So you force yourself to stay up. You stay up till maybe 9 or 10 o'clock and you go to bed, you fall asleep, but you're still waking up at 3, 4, 5 in the morning because that's when your core body temperature is rising. So now you're not even in bed long enough to get a full night's sleep. You may only be in bed 4 or 5 hours, and that's not enough sleep. And so what happens? You get up, you may feel alert here, but in the afternoon you're going to be tired because you didn't get enough sleep at night. So you take a nap somewhere in the afternoon. That nap allows you to stay awake later in the evening. You know, sleep is part of what we call a homeostatic process. What that means is you have to be awake a certain amount of time before you're going to be sleepy enough to fall asleep, just like you have to be asleep a certain amount of time before you're going to be fully alert. So if you take a long afternoon nap, that allows you to stay awake longer into the evening, but you're still going to wake up at 3, 4, 5 in the morning. So now you get into this pattern of not getting enough sleep at night and needing to nap during the day. Here's a second scenario. You come home in the evening, you sit down, watch TV or read, and what happens? You fall asleep. And you sleep for maybe half an hour, maybe even an hour. And by the way, when I ask people, do you fall asleep in the evening in front of the TV? Oh, no. I say, do you nap? Oh, no. I guess it turns out that sleeping in front of the TV doesn't count as a nap, right? So you may not even be aware that you're falling asleep, but you do. And because you sleep for half an hour, maybe even longer, you then get up, you go back into bed, and suddenly you can't fall asleep. And you can't fall asleep because you just slept. Remember, that's our homeostatic process again. If you just slept for half an hour and you're only awake for an hour or two, you're not awake long enough to be sleepy enough to fall back to sleep. So now you might come in to see me and say, you know what, Doc? I have problems falling asleep when I first get into bed at night, and I still wake up at 3 in the morning. And the reason that happens is because you have this advanced sleep phase in combination with what we call poor sleep habits or poor sleep hygiene. That is, this napping in the evening combined with this advanced sleep phase. And as I say, this is very common as we get older. And I would venture to say that over 90% of older adults have this problem, getting sleepy earlier in the evening and waking up early in the morning. Now, I say problem, but it isn't really a problem. This is not an illness. This is not a disorder. It's a very natural part of aging. And I've had patients come in who were very advanced and were very happy about it. They were going to bed early. They were waking up early. I had one patient in his 70s whose only complaint was he was going to bed around 7. He was getting up around 3. His only complaint was he didn't know what to do between 3 and 6 when the rest of the household woke up. So I suggested that he videotape all the shows he wasn't watching here because he was sound asleep, and he could watch them in the early morning hours. He loved that. That was all he needed. So there's nothing wrong with being advanced if it fits in with your lifestyle. That's really the bottom line. If your lifestyle is such that you want to stay up later and sleep later in the morning, then we need to do something to shift your rhythms. If your lifestyle is such that you're happy going to bed early and waking up early, you're a morning person, a lark, then there's absolutely nothing we need to do. But what can we do if we want to shift you? Well, the best way to shift rhythms is with bright light. Okay? For people who are delayed, that's that adolescent pattern of not wanting to go to sleep till 1 in the morning and sleeping till noon, we give bright light in the early morning hours or whenever they first wake up. And of course, the best source of light is the sun. So for people who are delayed, we tell them to take the blinds off your window, let the sun pour into your room, or go outside right away and get some bright light exposure. And what the light does is it shifts this rhythm or advances it so that these people get tired earlier in the evening and can wake up earlier in the morning. For people with advanced sleep phase, that's our older pattern of getting sleepy earlier in the evening and waking up too earlier in the morning, we need the light as late in the day as possible, ideally between 7 and 9 at night. Now the sun is hardly ever out between 7 and 9 at night, so what we recommend is that people who are advanced that want to shift go outside as late in the day as possible when the sun is still out. And certainly in San Diego, in the summer months, we can do that. We can go out around 6 or 7 o'clock and get that light exposure. Whether we're just sitting in the garden or going for a walk, whatever it takes to get outside. Now, here's a little twist in all this. The mechanism of the light affecting the rhythms is through the eyes. The light comes through the eye directly to the brain, to the suprachiasmatic nucleus, which is the part of the brain where the pacemaker for our circadian rhythm, where our circadian clock resides. So, if you wear sunglasses, it blocks the light. Right? Now, what do many older people do when they wake up in the early morning hours? They go for an early morning walk. What does that light exposure in the early morning do? It makes your rhythm even more advanced. If you get morning light, it means you're going to get sleepy even earlier in the evening and wake up even earlier in the morning. So, I never tell anybody not to take that walk or not to exercise. But if you go out in the early morning, you want to wear dark glasses to block that morning light. And you want to go back out again late in the day without sunglasses to get that bright light exposure. I'm not suggesting you look directly into the sun, but just taking a walk in the general environment, there's enough light to help your sleep. Unfortunately, there's not enough light inside our homes. So no matter how much artificial light you have in your room, that's not going to be enough light to really shift your rhythms. You need really, really bright light. There are light boxes available that people can buy, and if you're really advanced and it really bothers you, you can buy a bright light box and use that. I don't have a picture of it, but it's just a box that you can put on top of your dinner table or on top of your TV and sit in front of it and get that light exposure in the evening hours. So now we've talked about medical and psychiatric illnesses, we've talked about all the medications that we use, and we've talked about changes in our biological clock, all of which make it harder for us to get the sleep that we need as we get older. The last part I want to talk about is some of the primary sleep disorders that also affect sleep that are more common as we get older. This cartoon shows this man snoring very loudly, and snoring loudly is often a sign of a sleep disorder called sleep apnea. This is a disorder where people stop breathing in their sleep. They fall asleep, they stop breathing. In order to start breathing again, they have to wake up. So they wake up, they start breathing, they go back to sleep, they stop breathing. And this can go on for hundreds of times during the night. These people do tend to snore quite loudly. In fact, we ask them, how loud do you snore? Can you be heard only in your bedroom? Can you be heard one room away from your bedroom? Are you a 2-room snorer? Are you a 3-room snorer? And often they'll say yes. They really snore very, very loudly. And although it's the man snoring here and the woman complaining about it, in fact, we women also snore. This says, Adam, did I snore again last night? And he's got his ears plugged. So women do snore, and the older we get, the more common snoring is in all age groups. But both apnea and snoring are more common in men than in women, and more common in older men and women than in younger men and women. The other symptom of sleep apnea is daytime sleepiness. Okay? So when you do fall asleep during the day, like Marvin's grandpa in that first cartoon, one of the things we always need to consider is it because of the sleep apnea? Remember I said in order to start breathing again when you have sleep apnea, you have to wake up. These awakenings are usually so brief that the patient doesn't even realize that he or she is waking up, but it's enough to disrupt sleep. So if you're being woken up 20 times a night, 50 times a night, it's actually more like 20 times an hour, 50 times an hour, which means hundreds of times during the night, your sleep becomes very disrupted and you're tired the next day. And so you fall asleep. And patients with sleep apnea, with severe apnea, will fall asleep any time they sit down quietly. So they might fall asleep while sitting in conversation with friends. They would certainly fall asleep if they were sitting in a lecture or at the symphony or synagogue or church. They can't sit quietly and stay awake. And of course, there are different degrees of sleep apnea, which then affect or cause different degrees of daytime sleepiness. This is just showing you that the prevalence of sleep apnea does increase with age. We've got age across the bottom, and this is the prevalence of a certain amount of apnea. And you can see that with age, the amount of apnea that we have does increase. The good news is that it is treatable. It's not a very pretty treatment, but it is an effective treatment. Let me explain first that what happens in a sleep apnea, if you'll look at my hands here for a minute, what happens, if this is your airway, what happens when you have an apnea is that the airway in your airway actually collapses when you fall asleep. So although you might still be trying to breathe, the air can't get in or out. Okay? That's what an apnea is. So this treatment, which is called continuous positive airway pressure, or CPAP, is a mask that's worn either over the nose or over the mouth with a hose connected to a machine which pushes positive pressure through the airway, which acts as a splint to keep the airway open during the night. If you think of a water hose, when there's no pressure in the hose collapses, and when you turn the water on, that pressure opens up the hose. That's what's happening in the airway. So as I say, it's not a very pretty treatment, but it is very effective. It helps people breathe all night long, and when they're breathing all night long, they can sleep all night long, and they can get oxygen to their brain all night long, and it's a very effective treatment. There are other treatments as well. Sleep apnea is worse when you sleep on your back, and so if someone has apnea or snoring that's just on their back, we do this very elegant treatment. We sew a pocket into the back of a t-shirt and we stick a tennis ball in there. But what that does, of course, is it keeps you off your back. So this won't work if you have snoring or apnea in all positions. But if you snore or have apnea only on your back, this is one treatment. Another treatment is weight loss. Many patients with sleep apnea are quite overweight, or sometimes overweight by just 20 or 30 pounds. And if they're able to take the weight off, then the apnea goes away. And I have to tell you that as we get older, weight is less of an issue. As we get older, we seem to have sleep apnea even if we're not overweight. And so in an older age group, that might not be an effective treatment. Other treatments include oral appliances. There are all sorts of appliances that either pull the jaw forward or the tongue forward during the night to help keep the airway open. And then avoiding things that are respiratory depressants that make it harder for you to breathe, like alcohol or some of the older sleeping pills. There are also all sorts of surgeries. I have them shadowed out here because in older adults we don't recommend the surgeries. We don't recommend them that often in younger adults either because they're not as effective as these other treatments. But it is an option for someone with severe apnea where other treatments have not been successful. Okay, another sleep disorder. So this says, I dreamt I was driving down a mountain road and the brakes failed. And he's actually tried to step on the brakes. Well, remember I mentioned in the beginning that we have different stages of sleep? One of the stages of sleep that we go through each night is called REM sleep. It stands for rapid eye movement. And that's our dream sleep. We do most of our dreaming during REM sleep. And the reason it's called rapid eye movement is because during this kind of sleep, our eyes move quite rapidly. And so that's our dream sleep. During REM sleep, we are paralyzed, except for our eyes and our respiration. And this is a protective mechanism which keeps us from acting out our dreams. So if you were dreaming that you were driving down a mountain road, that's what keeps you from actually trying to step on the brakes. Or if you're dreaming that you're golfing, this is what keeps you from swinging your arms and actually trying to hit the ball. There is a sleep disorder called REM behavior disorder, where that atonia, that loss of muscle during REM sleep is gone. And these people then do begin acting out their dreams. So let me read this one case example for you. A 60-year-old surgeon began to punch and kick his wife and jump out of bed during nightmares of being attacked by criminals, terrorists, and monsters who always tried to kill me. Work-related stress was the presumed cause of his sleep disturbance, but the violent behaviors intensified despite retirement 3 years later. He sustained several head lacerations, and his wife once had a severe headache for 2 days after receiving an accidental blow to her ear. The proper diagnosis was established after 11 years. A prodrome of excessive limb and body jerking during sleep had been present for at least 33 years. That's a long time to have a sleep disorder without it being diagnosed. REM behavior disorder is more common in older men than in any other group. We don't know exactly what is happening or why it happens other than that atonia of being lost during REM sleep. And it's exactly as it sounds. These men do start acting out their dreams. Often the dreams can be quite violent, and so they can hurt themselves, they can hurt their bed partners. And these are otherwise men that are pussycats, you know, just the most gentle people. But it's just during sleep that they begin acting out. The good news, again, is that there is a treatment for this. It's treated with a medication called clonazepam, which is a very sedating drug, but also does cut out this REM behavior disorder. But it has to be taken every night. If you stop taking the drug, the REM behavior disorder comes back. But at least it is treatable. So this is another reason why sleep, or the ability to get a good night's sleep, might be reduced in an older adult. Okay. Here are Opal and Earl. Opal's sound asleep, cat sleeping on her feet. Suddenly the cat goes flying and Earl complains, "Opal, this cat's getting too darn frisky." Well, I don't know if the writer of this cartoon realized it, but I know it's not the cat, it's Opal. Opal has a sleep disorder that we call restless legs, or periodic limb movements in sleep. These are two separate disorders. Restless legs is a disorder where people have these creepy, crawly sensations in their legs, and they can't sit still. So they're constantly shaking their legs, or they have to get up and pace. Movement is the only way to relieve this terrible sensation. It's like having ants crawling up and down the inside of your legs. Some of you are shaking your heads. You know what I'm talking about. There's a second disorder called periodic limb movements in sleep, where people kick or jerk their legs every 20 to 40 seconds for periods throughout the night. So it's as if every time you start falling asleep, something shakes you and wakes you back up again. About 70% of people with restless legs also kick during sleep, but not everyone that kicks during sleep has restless legs. But both of these disorders are more common as we get older. In fact, about 45%, almost 1 out of every 2 older adults, has periodic limb movements in sleep and some restless legs. The good news, again, is that it is treatable. It's treated with what are called dopamine agonists. It's the same drugs that are used to treat Parkinson's disease, although these disorders are not related to Parkinson's disease. It's just the same drugs are effective. And the two that have been approved by the FDA for the treatment of restless legs are ropinirole and pramipexole. So these are the two that are used, and so if this is a problem you have, you should talk to your physician about being treated, because there's nothing worse than having this terrible restlessness. All right, so how do we treat the rest of our sleep problems? This says, so how about my insomnia, doc? And the doc says, oh, I wouldn't lose any sleep over it, kiddo. Well, hopefully when you go to see your doctor, that's not what your doctor says. There are ways to treat our sleep problems and to make sleep better. And the best way is to start with good sleep habits. Just like you brush your teeth and wash your face, and that's the habit before you go to sleep, there are good things to do to help your sleep get better. So what are some of our good sleep hygiene measures? First of all, setting a regular schedule. It is very important to go to bed and get up at the same time every day of the week, 7 days a week. No sleeping in any mornings. Had a bad night last night, want to sleep later in the morning? Don't do it. The same time for going to bed and the same time for getting up. Why? This comes back to our biological clock. Our biological clock, our circadian rhythm, needs one stable point around which it can fluctuate. While you can't control what time you fall asleep, the only point you can control is what time you get up in the morning. So that's why you have to get up at the same time every day. Now, if you're going to get up at the same time every day in order to get enough sleep, you also have to go to bed at the same time every day so that you're in bed long enough to get a good night's sleep. But you also don't want to spend too much time in bed. What do people who don't sleep well do? What does the insomniac say? You know, I didn't sleep a wink last night. I'm going to go to bed 2 hours earlier tonight to try to get more sleep. Well, the problem with that is the longer you stay in bed, the more fragmented and disturbed your sleep becomes. The less time you spend in bed, the more consolidated sleep is. So, 8 hours of sleep out of 8.5 hours in bed is much more efficient than 8 hours of sleep out of 9 or 10 hours in bed. So you don't want to spend too much time in bed. If you want to get 7 hours of sleep, you should be in bed for about 7.5 hours. You want 8 hours of sleep, you should be in bed about 8.5 hours, and not much more than that. Now, in our busy lives, often we never have time to think about what's happening until we get into bed at night. And that's the wrong time to start thinking and worrying. And for many people, it's these worries that keep us up at night. Now, this is going to sound very silly, the setting aside a worry time, but it works. It is very, very effective. If you find 10, 20 minutes, as much time as you think you need, earlier in the day, when you sit down and you turn off the phone and your cell phone and you turn off the radio and the TV and you just sit quietly and worry. That's your chance to think about all the things you usually think about at night. So whatever it is you're worried about, do it away from the bedroom and away from your bedtime. That way, when you get into bed at night, first of all, you've already thought about it. You don't need to think about it. But even if you start thinking about it, you know you have permission to do this again tomorrow at 2 o'clock, whatever your time is. It is a very, very effective tool. So you set aside a worry time earlier in the day so you don't have to worry in bed. Okay, what about napping? Now, obviously, there are whole societies that take naps. You know, the siesta, or in Spain or in the Middle East, lots of people sleep after lunch. And physiologically speaking, taking an afternoon nap makes perfect sense. You know, I told you how our core body temperature drops at night, and that's why we get sleepy at night? Core body temperature takes a dip in the afternoon, and that's why we get sleepy after lunch. It's not because of the big meal you ate, it's because of that afternoon dip in our core body temperature. So physiologically, it makes sense to nap. But if you look at the cultures that do that, you'll also recognize that they go to sleep at night much later than we do. They eat dinner later, they go to sleep later, and in a 24-hour period, they're sleeping the same amount of time that we are. They're just doing it in 2 bouts, a little bit in the afternoon, a little bit at night. We, in our culture, do it in 1 bout. So, it's okay to take an afternoon nap if it doesn't disrupt your nighttime sleep. This goes back again to that homeostatic process I described earlier. Remember, you have to be awake a certain amount of time before you're going to be sleepy enough to fall asleep. If you take a 2-hour nap and then try to go to bed at 10, you won't be sleepy enough to fall asleep. So if you are going to nap, keep it in the early afternoon and limit it to 30 minutes, half an hour or less, because anything more than that is likely to disrupt your sleep at night. Increasing bright light during the day. We also already talked about how important bright light is, and even not just getting it in the afternoon, which is going to help your rhythms, but in general, the more bright light exposure you have, the better you sleep. Avoiding heavy meals, and particularly drinking a lot right before bedtime, because of course that's going to increase the likelihood that you're going to need to get up to go to the bathroom. And avoiding alcohol and nicotine. There are many people that use alcohol to help them sleep at night. And alcohol does make you sleepy initially. But several hours later, when the alcohol leaves your bloodstream, it wakes you back up again. Alcohol causes insomnia. If you drink with dinner, you might be sleepy initially right after dinner, but several hours later, when it's time to go to bed, you might be wide awake. So if you're having difficulty sleeping, you want to avoid alcohol in the evening. And in case you still smoke, there's one more reason to stop, because nicotine also disrupts sleep. How about caffeine? This is how many times have I told you no coffee after September? One of my favorite slides. So obviously caffeine is going to disrupt your sleep. And I just want to very quickly show you how much caffeine are in different things. And it's not just coffee. Soda has caffeine. And notice, regular 7-Up has no caffeine. Diet 7-Up has 23 milligrams. Right? Minute Maid orange soda has none. Sunkist orange soda has 28. You need to read the labels on sodas, because there are many sodas that will have quite a bit of caffeine. And as you can see, soda doesn't have to be brown to have caffeine in it. It's not just the colas. Lots of sodas and all the energy drinks that are out there all have caffeine. How about coffee? A latte, 90 milligrams of caffeine. Decaf espresso still has 10 milligrams. Don't think that decaf means there's no caffeine in it. And if you're particularly sensitive to that and you drink that decaf at night, it could still make it hard for you to fall asleep. Teas have caffeine in them, other than the herbal teas. And coffee ice cream. Coffee ice cream has 40 to 60 milligrams of caffeine. A non-fat coffee fudge yogurt has 85 milligrams. It may not be fattening, but it's got a lot of caffeine in it. So think about what you're ingesting late in the day that might be disrupting your sleep. Exercise. It says I toss and turn all night, and you won't count that as an 8-hour aerobic workout? Well, the more physically fit you are, the better you sleep. It doesn't mean you have to go out and play 5 rounds of tennis. It means you do whatever you're able to do. If that means going for a walk, if that means just sitting and bouncing a ball around, whatever. Tai Chi, yoga, anything that's exercise for you is going to help you sleep better at night. But particularly if you exercise 6 hours before bedtime. This comes back to our core body temperature. Remember we said core body temperature drops, that's when we get sleepy. When we exercise, core body temperature goes up. And it takes about 6 hours for it to start dropping again. So you could actually use the exercise to help you fall asleep faster when you're ready to go to bed. I told you that we need a lot of bright light during the day, but as much as we need bright light during the day, we need darkness at night. Our sleep is also controlled by a hormone called melatonin. You've all heard of melatonin because it's also sold over the counter, and people use it for all different things. But melatonin is a hormone that's produced in our brain. And melatonin is what we call our hormone of darkness and our sleep hormone. Melatonin is secreted in darkness. If you turn the light on at night, if you have any light in your bedroom, that's telling your brain, time to get up, stop secreting melatonin, and it makes it harder to sleep. So you want to make your bedroom as dark as possible, you want it as quiet as possible, and you want it at a good, comfortable temperature, not too hot and not too cold. Okay, when you wake up in the middle of the night, what's the first thing you do? Somebody call it out. Go to the bathroom. Wrong. It's not go to the bathroom. Someone said it back there. You look at the clock, right? Don't you look at the clock before you go to the bathroom? What do you have to do to look at the clock? You have to open your eyes, turn your head, maybe even lift it, but worse, you have to wake yourself out. You're taking yourself from what we call transitional sleep, or that stage 1 sleep, to full awakening, so you can comprehend that it's 1:20 in the morning and you want to be asleep. What have you just done to yourself? Remember our homeostatic theory. I keep coming back to that. You have to be awake a certain amount of time before you're sleepy enough to fall back to sleep. You just woke yourself up. You're going to have a much harder time going back to sleep. So what do? Turn the clock around, stick it in a drawer, put it on the other side of the room. Don't look at it. And the only way not to look at it is to put it somewhere where you can't see it, because it's just too tempting to peek and see, okay, how many hours do I have left till I have to get up? Or how many hours have I been tossing and turning, right? Don't do it. When you wake up in the middle of the night, keep your eyes closed, don't even open them. You have a much greater chance then of falling right back to sleep. Now you're going to tell me, but I have to go to the bathroom. Needing to go to the bathroom does not wake you up. You wake up first for some other reason, and once you're awake, you realize that there's pressure and you need to go to the bathroom. So if you can keep your eyes closed and drift right back into sleep, you may not even need to get up to go to the bathroom. But if you do need to get up, what you don't want to do is turn on the light. Remember we just said if you turn on the light, that tells your brain it's time to wake up. I found this wonderful picture in a magazine. I think everyone should have these slippers, because this way you don't have to worry about falling if it's dark in your bedroom or on the way to the bathroom. You can see where you're going and you don't need to turn on the overhead lights. But if you can't get these slippers, use a night light. The idea is to keep as little light as possible. You want to be safe, but you don't want that much light that it's going to disrupt your sleep. Okay, other treatments, and I'll try to go through this quickly because I think we're running out of time. The best treatment that we have is a treatment called cognitive behavioral therapy. About 2 years ago, the National Institutes on Health held a State of the Science conference on insomnia and came out with some very important conclusions about the treatment of insomnia. One of the things they said was that cognitive behavioral therapy was found to be as effective as prescription medications for the treatment of chronic insomnia. Cognitive behavioral therapy is basically all the sleep hygiene rules I just taught you, plus a few others, plus dealing with some dysfunctional beliefs that someone might have about their sleep. So for example, someone might say, you know, if I don't get exactly 8 hours of sleep, I cannot function the next day. Well, yeah, 8 hours is the recommended time, but if you sleep 7.5, you're still going to be able to function. So cognitive behavioral therapy deals with these kinds of things, and it is the most effective treatment we have. But obviously, there are also a lot of medications that people use to help them sleep, and sometimes they're appropriate, sometimes they're less appropriate. One of the medications that's often used is diphenhydramine or other antihistamines. Diphenhydramine is what you find in your over-the-counter medications, like any drug that has the letters PM after it. So you know the ones I mean. And the advantage of these drugs is that you can go to the drugstore and buy it. You don't need a prescription, and they're cheap. And they are perceived as being safe because you can buy them over the counter. But the truth is, the hypnotic dose is not well defined. I can't tell you how many of those PM drugs you need to take so that you get a good night's sleep and not be hung over the next day. That is, not wake up still feeling drowsy. And also, within about a week, if you take it every night, you might become tolerant to it, which means you need to take more and more for that same drug to be effective. The bigger problem is that these drugs do have side effects. They cause sedation, not only at night when you want to be sedated, but the next day. They cause grogginess, so if you do need to get up at the middle of the night, you're at danger of falling. Dry mouth, blurred vision, urinary retention, impairment in motor activity, dizziness, delirium. Not good side effects. These are data from a study that was done in older patients who were in the hospital for all the reasons that older patients go into the hospital. These were not patients with dementia. They were given diphenhydramine for 25 to 50 milligrams, which is exactly what you find in all those PM drugs. And they were given it because they needed help sleeping 68% of the time. And they ended up with symptoms. You can read them here: delirium, inattention, disorganized speech, agitation, poor sleep. What do these symptoms sound like? They sound like dementia. But it wasn't dementia. It was all because of the diphenhydramine. These are not benign drugs. These are not good drugs to take to help you sleep. And that's not just me saying it. The NIH, the National Institute on Health, said the same thing. They said that there's no systematic evidence for efficacy of these drugs. There's no evidence that they work in helping you sleep better. And there are significant concerns about the risks of these drugs. So if you have these drugs in your medicine cabinet because you bought them at the drugstore, consider not using them for sleep. The NIH also said that antidepressants have potentially significant adverse effects, raising concerns about the risk-benefit ratio. I'm talking about here about the use of antidepressants for sleep in someone who is not depressed. If someone is depressed, then an antidepressant is the natural thing to give. But if someone is not depressed, that is not the best drug to use. And it's used often because it is a sedating drug. And they also said that barbiturates and antipsychotics have significant risks in patients that are not psychotic, and so their use in the treatment of chronic insomnia cannot be recommended. So what they did recommend is essentially some of the newer, what we call short-acting non-benzodiazepines. The longer benzodiazepines, the ones people used to take like Dalmane, are very long-acting, and although they're quite effective, they're not as safe as the newer drugs. So, what are the newer drugs that they're recommending? The newer drugs are isoprene, which you would know as Lunesta, Zaloplan, which is Sonata, Zolpidem, which is Ambien, Zolpidem CR, which is Ambien CR, and Ramelteon, which is Roserum. Studies have been done in all these drugs in both younger and older adults, and they've all been shown to be safe and effective. But the key question is, how do you know which one is the right one for you if a drug is even appropriate for you? As I said, the behavioral therapies are really the way to go. But if your doctor is going to prescribe a drug, the two questions that doctor should be asking you is, first of all, what is your complaint? Are you having difficulty falling asleep or difficulty staying asleep? And that'll determine which of these drugs is the right drug for you to take, because some of them help people fall asleep, others might help people stay asleep, but they don't always do both. And the other question, which I think is even more important, is how much time do you have to devote to being in bed? Although I'd like everyone to be in bed at least 8 hours, I'm realistic enough to know that that doesn't always happen. So for example, with isoprene, you have to be in bed at least 8 hours before you take that sleeping pill. So if you're not going to be in bed 8 hours, that's the wrong sleeping pill for you. And that's when people get into trouble with these drugs, when they use them inappropriately, when they're given the wrong drug for their problem, when they're given the wrong drug for the amount of time they're going to be in bed, or if they use these drugs inappropriately. But if they're used correctly, they can be safe and effective. So to summarize, not sleeping enough at night is going to cause daytime drowsiness. You're going to be sleepy during the day, and you're not going to be able to function quite optimally. Our circadian rhythms, our biological clock, advance as we get older, and so as we get older, we get sleepy earlier in the evening and we wake up earlier in the morning. Exercise and light exposure will help you sleep better at night because the light helps reset our biological clock. You want to make your environment as conducive for sleep as possible. Keep it dark, keep it quiet, and keep it comfortable. Stick to a regular schedule. Go to bed and get up at the same time every day. Not sleeping well at night and then napping too long during the day may actually make your sleep worse. And consider some of the primary causes of sleep disturbances. Think about whether it might be your medical or psychiatric condition, whether it might be the medications you're taking, or if it's might you perhaps have one of the sleep disorders that we talked about. So remember, aging on its own doesn't cause a sleep problem. Just because we get older doesn't mean our sleep should get worse. It's all those other things that happen to us as we age that make our sleep worse. And those are usually things that we can do something about. And I want to end with this quote. It says, "Aging seems to be the only available way to live a long life." Thank you.